Hi, Dr. Osborne with Web Wellness University. Today I want to talk about what your doctor didn't tell you about correcting your blood sugar naturally or helping blood sugar problems naturally using a functional medicine approach. In this drawing you can see behind me, we basically laid out the premise for how blood sugar works. You've got your pancreas, your bloodstream, and your cells. These three elements all have to communicate appropriately in order for your blood sugar to be regulated and to help to prevent diabetes. So the first thing that happens, step number one, is we eat food, right? And so the food that we eat largely is going to contribute to either a normative amount of sugar in the bloodstream or potentially an excessive amount. Now the three foods that we know can contribute to higher levels of blood sugar, one is obvious, and that's sugar. And most people know that sugar is a problem, so that's not rocket science. But we also have other foods that we know can trigger elevations in blood sugar, and that's dairy and grain. And both of these food groups are potentially and largely going to contribute to an excessive quantity of sugar hitting your bloodstream. Once you take that food, it's broken down in your gut and converted. Much of it can be converted into glucose, and now it's in your bloodstream. And so when that happens, that glucose will send a message to your pancreas. This is what we're going to call step 2. And it will ask your pancreas, hey, we have glucose in the blood, we need you to release insulin. So this will be step 3. So that insulin release is a critical component to how this process works. Once we release insulin, that insulin then has to come and interact with this receptor on the surface of our cell called an insulin receptor. This is also sometimes referred to as the GTF or glucose tolerance factor receptor. This receptor, once activated, will send a message through the cell. Okay, that's what we're going to call step 5, and it's going to open a doorway on the surface of the cell, and this doorway is then going to allow that sugar, that glucose, to come into the cell, and that's how we produce energy. Okay, once we get that sugar in the cell, we can now take it through some biochemical processes where we're going to break it down and we're going to make what the body uses for energy, that substance known as ATP. So that would be step 6. So when we think about diabetes and we think about people that have blood sugar dysregulation, what we're really saying is that there's a breakdown fundamentally in the way that this pathway works for them. And so now that you kind of understand the pathway in general, let's go back through and let's plug in again some of those things your doctor probably didn't tell you about, the nutritional elements that are required for this pathway to work appropriately. The first thing obviously is the food, sugar, dairy, and gluten. So one of the quickest ways to reduce blood sugar from a dietary perspective is to control the intake or the input of these particular food agents. So we can always control food. It's one of the easiest things to control, and you should be aware. A lot of people have been told, go to whole grain to help lower your blood sugar, go to whole grain to help reduce your risk of heart disease, and nothing could be further from the truth. Once we have that glucose in the bloodstream, to signal the pancreas, this particular element requires nutrition. And so what is required for that to occur is vitamin D. If you don't have adequate quantities of vitamin D, and it's speculated somewhere in excess of 50% of the average U.S. population has some degree of vitamin D deficiency, if you don't have adequate vitamin D, it's going to be very, very hard for your glucose to talk to your pancreas so that you can get an insulin release. So vitamin D deficiency in and of itself is highly linked to diabetes and blood sugar irregularity. So one of the things you can have your doctor do or ask your doctor to do is check your vitamin D level. Now, once we have done that, we say, okay, well now the pancreas has to make insulin. Well, what's required here, one of the key nutrients for insulin production is zinc. Zinc is actually the center molecule that holds insulin together. And so without zinc, you're going to have an insulin that's less effective. You're going to have an insulin that doesn't work as well. Now, magnesium is also required in this process. So if you don't have adequate quantities of magnesium, and the majority of the population also doesn't get adequate magnesium in their daily intake of food. So now we've got 2 nutrients, 3, that are going to impact this pathway. Again, these 2, zinc and magnesium, are going to influence how well your pancreas is capable of producing the hormone insulin. Now this insulin has to interact with this insulin receptor on the surface of the cell, okay, the cell being here. And remember I said earlier that an insulin receptor is called the glucose tolerance factor. That's its nickname, right? So that is made out of chromium. Chromium is a mineral, and without it, we're going to have a hard time regulating blood sugar. But this insulin receptor also requires vitamin B3, also known Many of you have heard of niacin. Now, some doctors actually prescribe niacin. This is a drug that can lower cholesterol, it can raise HDLs, it can lower triglycerides, but it's actually a B vitamin, not really technically a drug. But it's also, again, necessary for the insulin receptor. So, a deficiency in chromium or B3 are going to make somebody more insulin desensitized. They're going to make that receptor not work as well. In step 5 right here, where once we've triggered that insulin response or that insulin receptor to send a message through the cell, that message requires calcium. So without calcium, it's very hard for your cell to open that glucose door. And so we have to have calcium for that message to occur. Calcium is what's called a secondary messenger in this process. Now, once this door gets opened, okay, so if steps 1 through 5 are all firing okay, if we've got adequate vitamin D, we've got adequate zinc, magnesium, chromium, and vitamin B3, and our diet is pretty square, we can still have a fundamental breakdown even if we get that sugar inside the cell. Because for that energy to be produced as a result of breaking that sugar down or that glucose down, we require a number of different nutrients. We require CoQ10. We require magnesium 16 different times. Or actually rather 8 different times. There's a biochemical process that requires about 16 different steps, and 8 of those steps require magnesium to be able to make that energy. But the other thing, we always hear about how B vitamins are so critical for energy production, and this is actually the reason why, is there's this process within our cells, within our mitochondria, that utilize large quantities of vitamin B2, vitamin B3, B1, B5, and without these particular vitamins, we're not going to get that sugar broken down inside the cell to be able to produce the energy that our body needs. So ultimately, these 6 steps in the pathway of controlling blood sugar and regulating blood sugar are all driven nutritionally. And so again, if you go back to what probably your doctor did tell you, which is, hey, you're diabetic, your parents are diabetic, you're going to have to take this medication for the rest of your life. You're just going to have to come to terms with that. And by the way, eat right and exercise. What does that really mean? We want to understand that eating right means incorporating and including all of these different nutrients in quantities large enough to expedite and help this cycle work appropriately. The other thing, though, that I would have you ask your doctor to check are all these different nutrient levels. And this is very easy to be done. It's just a matter of having a doctor who is going to be conducive or is actually going to have the right mindset nutritionally to help you along with this process. So if you have problems regulating your blood sugar, if you have problems with diabetes, take this video to your doctor, show this video to your doctor, start looking at these parameters. You may be missing a key nutritional element to managing your blood sugar. Hope this was helpful for you. This is Dr. Osborne with Web Wellness University. Have a great day.